Hello and welcome to this introductory presentation about MO1019 Oedema and Lymphoedema. This module focuses on the development of your clinical knowledge and skills in the management of chronic oedema and lymphedema in rural generalist practice. You'll develop skills in assessment, prescription, fitting and monitoring of compression garments for people with stabilised chronic oedema and lymphedema while developing your understanding of risk assessment and referral pathways. The module draws from the Queensland Health Allied Health Professions Compression Garment Selection, Fitting and Monitoring Education Program. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of the etiology, pathophysiology and clinical presentation of stabilised chronic oedema and lymphedema with assessment and clinical reasoning skills to formulate and communicate care plans designed to optimise care in the rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. This module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, overview of oedema and lymphedema, you'll register for and enrol in a Queensland Health iLearn compression garment education package, which this module draws from. You'll develop a supported practice training plan in collaboration with your work-based supervisor and identified lymphedema therapist mentor before identifying a client for assessment item 1 and gaining their consent to partake in a clinical assessment in which you will actively participate under the supervision, face-to-face or remote, of your identified lymphedema therapist mentor. You'll test your knowledge of oedema and lymphedema before beginning to learn more about them. Lastly, you'll identify and make contact with at least one health professional different to your own who works with clients experiencing oedema and lymphedema in your local area and ask if they would be willing to discuss assessment and interventions in the coming weeks. In week 2, assessment of chronic oedema and lymphedema, you'll learn about how oedemas and lymphedema present, are diagnosed and assessed. You'll practice palpation and measurement on a colleague before considering when, how and to whom referrals should be made. You'll complete the week by completing a case scenario and submitting the module workbook to gain feedback on how you are going. In week 3, management of chronic oedema and lymphedema, you'll explore the management of oedema and lymphedema, including professions involved and scopes of practice, before beginning to take a closer look at compression therapy. In week 4, compression garment prescription, you'll learn about the various factors in choosing appropriate garments. You'll learn about fitting, wearing, care and review of garments before touching base with your lymphedema mentor therapist to clarify any topics that are not clear to you. In week 5, supervised practice, you'll actively participate in a clinical assessment of your client supervised by your lymphedema therapist mentor who either is present for the assessment in person or views the assessment via video link. In week 6, care planning, you'll develop a care plan for your client based on the assessment undertaken in week 5. You'll troubleshoot the complexities of delivering evidence-based healthcare in rural and remote contexts before discussing and refining the care plan and your supported practice training plan with your lymphedema therapist mentor. Finally, you'll finalise and submit assessment item 1. A single assessment task is due at the end of the module in week 6. This is a written care plan for a client with stabilised chronic oedema or lymphedema. You will also have the opportunity to submit a formative piece of work at the end of week 2. This is your module workbook. It is not marked but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who will be taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment tasks and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.